Well, good morning. My name is Christine Liao. This is Haley Chambers and Samuel Story, and we're Team RBJ from LBJ. We're from the LBJ School of Public Affairs in Austin, Texas. Well, y'all know Austin, right? Live music capital of the world, a little thing called Austin City Limits, South by Southwest. It's pretty much the hipster haven of the South. This is how we know Austin. But did you know that Austin had the second fastest growing senior population in the entire United States from 2000 to 2010? Today it's ranked closer to number 3, and it's beat only by Raleigh, North Carolina, and Atlanta. So you see, this phenomenon is not specific to Austin. This silver tsunami, as it's called, is taking hold all across the United States. In fact, by the year 2050, the senior population in the United States is expected to almost double and account for 81.7 million people. Well, we didn't know much about this issue either until about a year and a half ago when we set out with a team of 8 student researchers and we studied community-based long-term healthcare models for seniors. In particular, we studied a model that allowed low-income seniors to live in their homes but receive affordable healthcare within the community. Our year-long research culminated in what we called an Elder Care Summit, in which we invited members from all over the Austin community. We invited political figures and other health policy experts. We presented them with our research and our findings. Well, we had a special guest in the audience that day, Miss Lucy Baines Johnson, daughter of President LBJ, and she asked the final question during our audience Q&A. She started out by telling us how important it was that we were studying this issue. She said that even her family, with as many resources as they had, still found it difficult at times to provide care for their aging mother, Lady Bird Johnson. And then she said, "What I really want to know is why are you, young, healthy-looking individuals, studying this topic? Why did any of you choose to study it in the first place?" And we looked at each other like, that's a really good question, and not one we prepared an answer for. So as we all kind of stared at each other blankly, Haley here stepped up and said, "Well, to be honest, we all have parents, grandparents, loved ones, people we care about, and we want to see them maintain a good quality of life as they age. But more importantly, at some point, we all ask ourselves, how do I want to be taken care of when I can no longer take care of myself?" Unfortunately, our research revealed that the program we studied for a year didn't have enough political support in Texas. So it wasn't financially feasible, and it wasn't scalable. But the end of that project led to the beginning of this one, in that the 3 of us sought to carry the task forward. We felt confident that with all of our knowledge and our community connections, we knew the best affordable senior care model, and we could bring it to Austin. We call this model the RBJ Senior Care Model, and it has 3 components. Number 1 is primary care, specifically geriatric primary care. We know that this population has higher rates of chronic illness and frailty, so these individuals really need quick access to care for acute illnesses such as colds or infections, because this is really the foundation of good health. Number 2, the best models have access to affordable wraparound services. And wraparound services are essentially non-medical services that support overall health. So this could be anything from a nutritious meal to help cleaning around the house. It could also be transportation to a medical appointment, to the grocery store, or even just to see a friend. And number 3 is the Adult Day Center. We know that individuals that regularly participate in community activities and interact with friends and peers on a regular basis, they have better long-term health outcomes. And finally, we know that the best senior care models align with affordable housing. While affordable housing is not necessarily medical care, it's consistently rated among seniors as one of their top concerns for their ability to age in place in their homes and in their communities. What's special about this model is all these services are co-located in the same place. So now that you're caught up on the model, here's the opportunity. This is the RBJ Center. This is an affordable, independent living center for seniors in Austin. This is the brainchild of President LBJ, and it's named after his mother, Rebecca Baines Johnson. Well, currently, the RBJ Center is undergoing a massive redevelopment in which they're turning 250 affordable senior units into 500 senior living units. What's great about this project is this is going to happen regardless of the outcome of our proposal, so we consider this a win from the beginning. So for our purposes, the real opportunity lies just a few hundred feet away from this redevelopment. In this circle is a 5-story building that's owned by the city of Austin. Currently, it just has a few offices and a small clinic in it, but a lot of the building is empty. Well, The RBJ board for this redevelopment project has expressed a sincere desire to put senior services in this building for the community. Well, with this in mind, we reached out to our old partners to see if they were interested in this opportunity.
Now, since the RBJ senior care model is the first of its kind, we've been very successful in gathering the proper support and buy-in from local hospitals, nonprofits, and advocacy groups in order to move on to the next steps. Seton Medical Center, the main nonprofit hospital in Austin, will provide the $3 million needed to renovate the existing building, being either purchased or leased for this endeavor. Now, these renovations will equip the existing space with the proper resources to run the adult day clinic and the adult day health center, while also updating the building to comply with any fire and safety codes. Additionally, we have reached out to Central Health, who will provide the day-to-day operational costs as soon as the RBJ Community Care Center opens its doors. Now, they will be able to do so because the RBJ Community Care Center will be a federally qualified health center, or an FQHC, meaning that this center can receive funding from the federal government through Central Health because of the services that it will provide to the community. We have also partnered with the Dell Medical School at the University of Texas in order to provide those primary care services being paid for through Central Health. Now, the majority of the services being provided at this center will be covered by Medicaid and Medicare, making this a stable endeavor. Because of this, we also know that the center will be financially solvent in approximately 3 years after it opens its doors. FQHCs have bipartisan support, so we know that this is a stable endeavor from the moment we begin renovations to the day the center opens its doors and beyond. We have also identified Family Elder Care, a local nonprofit in charge of providing affordable wraparound services to the City of Austin, as a partner to provide those wraparound services and also run the Adult Day Health Center at the RBJ Community Care Center. Now, the RBJ senior care model provides critical support and care to a vulnerable and underserved population. But we know that this impact extends far more than just that specific population and to the City of Austin as a whole, and also potentially the nation as well. There are many studies that prove the benefits of increased healthcare visits and time spent at an adult day center on the aging population. But we know that these benefits extend to the family members, caregivers, and loved ones as well. The RBJ senior care model would positively affect those who are directly involved in the care of an aging individual, or those who just simply love and cherish that individual and want to see the best for him or her. For example, grandchildren will rest assured knowing their grandparents have access to affordable housing, healthcare services, and other life necessities, for example, nutritional meals or a clean home environment. Finally, understanding that the senior population in the United States will practically double in the next 30 years, we anticipate that cities across the nation will be looking for practical and feasible solutions to the issues created by such a sudden rise in this population. We believe that the RBJ senior care model is that solution. Aligning affordable housing with healthcare services is both practical and possible solution. So while we continue towards implementing the RBJ senior care model at the Rebecca Baines Johnson Community Living Center, we know that we must not only work with our key financial supporters, but with the members of the community as well. Our next and immediate step is to create and implement a community mobilization plan that promotes the RBJ Community Care Center to the RBJ residents and the surrounding neighborhoods. Now, this campaign will consist of 3 main components. First, we will develop a market pamphlet mailer, like the one shown above, that we will advertise the center to the surrounding neighborhoods. Second, we will create a 2-minute promotional video that advertises the opportunity for this program. And third, we will use these promotional materials in order to raise awareness for a town hall event for the RBJ residents and the surrounding neighborhood. Immediate funding would allow us to properly execute this community mobilization plan and move forward with our project.
And now I'd be happy to answer any questions that you have. Thank you.